Dissection of pectoral region, second part. Objectives is to study the pectoralis minor, subclavius and clavipectoral fascia, to identify and trace the cephalic vein, thoracoacromial artery and medial and lateral pectoral nerves, to explore the continuity of the axillary vessels with subclavian vessels. Cut across the clavicular head of pectoralis major below the clavicle and reflect it towards its insertion. This is clavicular head of pectoralis major, deltoid muscle, cephalic vein in the deltopectoral groove. Identify the branches of lateral pectoral nerve and thoracoacromial artery that pierces the clavipectoral fascia to enter pectoralis major muscle. Pectoralis minor, pectoralis major, lateral pectoral nerve, the common trunk of lateral pectoral nerve, thoracoacromial vessels, axillary artery, axillary vein, lateral cord of brachial plexus. Cut across the remainder of pectoralis major about 5 cm from the sternum. Reflect it laterally. Identify the branch of medial pectoral nerve which pierces pectoralis minor to enter pectoralis major. Note the entire sheet of clavipectoral fascia which is covering the pectoralis minor and that is located deep to pectoralis major. Then remove it from pectoralis minor. Axillary vein, medial root of median nerve, lateral root of median nerve, axillary artery, biceps brachii, coracobrachialis. Trace the pectoralis minor to its attachment, origin, insertion. Origin is from 3, 4, 5 ribs inserted to coracoid process. Short head of biceps brachii also can be seen attached to coracoid process. Follow the cephalic vein through the upper part of clavipectoral fascia to the axillary vein and thoracoacromial artery and the lateral pectoral nerve to their origin. Clavicle, deltoid. Expose the vessels and nerves superior to pectoralis minor. Thoracoacromial artery which is dividing into 4 branches. One branch is pectoral artery supplying pectoralis minor and major. Another branch of axillary artery, this is called lateral thoracic artery, which is seen on the lateral border of pectoralis minor. Axillary artery, thoracodorsal artery also can be seen. It is a branch of subscapular artery, which is a branch of axillary artery. Cut through the anterior layer of clavipectoral fascia immediately inferior to and parallel with the clavicle to expose subclavius muscle. Clavicle, median nerve, musculocutaneous nerve, axillary nerve, subclavian artery. Gently push a finger inferior to that muscle, that is subclavius. along the line of axillary vessels. It will pass over the first rib deep to the clavicle into the root of the neck. Clavicle is cut and lifted. Cephalic vein draining into the axillary vein, subclavian vein. If the finger is pressed medially between axillary artery and vein, a firm resistance of scalenus anterior muscle can be felt on the upper surface of first rib between axillary artery and axillary vein. Axillary vein continuing as subclavian vein, axillary artery which is a continuation of subclavian artery. In between the artery and the vein, scalenus anterior muscle can be seen. Note that the vessels felt on the first rib are subclavian vessels. Subclavian artery, subclavius clavicle. Pass a finger deep to pectoralis minor through the lower part of axilla. Pectoralis major, pectoralis minor, medial pectoral nerve which is piercing pectoralis minor, thoracoacromial artery, branch of axillary artery, axillary vein, intercostobrachial nerve, axillary fat and lymph nodes. Lift pectoralis minor from the subjacent structures but preserve medial pectoral nerve which enters the pectoralis major after piercing pectoralis minor. Lateral pectoral nerve supplying pectoralis major.